here to interview Dr. Gina Boutwell, pediatrician here at South Shore Medical Center. Hi.
Hi.
How are you, Dr. Boutwell?
I'm good, thank you.
You know, this is the time for getting ready for back to school. So we're here to talk to you about all the things that families and parents in particular should know, or at least begin to think about in preparing their children to coming back to school. So let's first talk about immunizations.
Okay.
And we know that oftentimes there's a little bit of controversy. Some parents are okay with immunizations and others are not. What's your sense and suggestions?
Well, I would just, make sure you have your annual physical, talk to your doctor about the vaccines that you need for school. Depending on how old they are, there's certain ones that are required at that school level. Most kids entering kindergarten will have what they need, if they've been to the doctors routinely. Generally, the schools don't allow you to not be immunized unless there's a true medical exemption, and occasionally there's some religious type exemptions. But if you've been to your usual annual checkups, they should have everything that they need, and they just probably need to make sure that they get a health form from their provider to give to the school so they can prove that.
So what can a parent do to keep their child healthy and free of catching various infections?
One good thing is teaching them to wash their hands as often as they can, definitely before eating at school. I think the teachers are pretty good at reminding them, but talk to them, make sure that they know why they're having to do that. You could even pack a little hand sanitizer in their backpack so they have that in case they're at lunch and weren't somewhere first where they could wash their hands. Talk to them about not biting fingernails and putting their hands in their mouth, touching their face as much as they can at school, because that's sometimes how viruses and things will get into their system. Another thing to think about as we're approaching the fall is getting flu shots. Flu shots are important. We recommend it for all school-age kids every year to get that flu shot to protect them from flu, because flu is a very contagious virus and can spread very quickly and rapidly through the classroom, coughing, sneezing, etc.
Especially if there's a grandparent, let's say, living at home with them.
Yes, flu is especially more dangerous in children, very young children, and the elderly. So if you do have someone more at risk in your household, even kids with health problems such as heart disease or asthma or diabetes, they're more prone to serious infection with the flu. So by immunizing your healthier children, too, it protects those that maybe are more at risk from bringing it home and passing it along to Grandma or Uncle Joe or whoever.
Let's talk about backpacks.
Okay.
And often, many of our children going into school, they come home with materials, books, heavy books. Do you have guidelines and suggestions on making sure that backpack safety in terms of weight bearing? What do parents need to know about that?
I mean, I don't necessarily have a particular weight limit to suggest. I think there are, especially the older grades, they are required sometimes to carry some pretty heavy books in their backpack that can add up to the amount of weight. I do usually recommend to my patients to try and balance the weight on both shoulders. So if they have your standard type of backpack, make sure you're using both straps, using both shoulders, standing up straight. The ones that just hang on one side might tend to bother their back a little bit more. I know some of the younger kids will even use some of the rolling ones. The older kids don't really necessarily like those, but and I would just make sure your kid doesn't seem like it's too heavy for them. Some schools will allow some books to stay at home. They don't necessarily have to go back and forth all the time. You can always talk to the teacher and find out if that's an option, if there is too much weight and they're uncomfortable carrying it.
A lot of our children are involved in sports, and in some cases they may encounter sports injuries, sports-related injuries. Do you see a lot of that what advice might you have for parents in preparing their children to engage in sports?
Same thing, you want to have your, your regular annual checkup, make sure there's nothing predisposing anyone to any particular injury. At the middle school and high school level, with their sports in school, usually you need to have that annual physical within 13 months to be allowed to participate. And they are now also requiring students to have a baseline impact test done, just sort of preliminary in case if they were to get a concussion. They use the impact testing as a way to know when they're better from that. So, it might be worth talking to your provider about concussion testing, impact testing, getting a baseline if they're involved in a sport that might be more apt to cause head injury, because it's a good tool to use to know when they're better to go well enough to go back to sports, and also when they're able to go back to the classroom and dive right in and get their work done.
You talk about baseline testing for concussion.
Concussion, yep.
And here at the South Shore Medical Center, are you holding concussion clinics of some sort?
We do have a concussion program here at South Shore Medical Center. We do offer baseline testing. Once you do a baseline, it is good for 2 years. It's done usually in the school system at the high school level, sometimes the middle school level, but it can be done in kids as early as 5 years old. We usually encourage it in some of the kids with more of the helmet type sports we call, like football, hockey, lacrosse, even soccer though, and cheerleading. Those athletes can be more prone to head injury. So we have a clinic where we can do the baseline testing, but also if we do have a student that's injured, we follow them up. We can do post-injury testing, and we have a concussion program where once they're seen and diagnosed with a concussion, they're filtered into the program and followed on a routine basis till they're better. We provide the notes to the school as far as academic accommodations, and ultimately provide the clearance and the appropriate paperwork for the state to allow them to go back to play when they're ready.
Oftentimes some of our older students, they don't want to be, assigned to concussion protocol because that means they miss out on a game or two. So they'll try to perhaps conceal it.
Right.
What should a parent look for in terms of telltale signs of concussion?
Yeah, that can be troublesome because they don't want to miss the game. Generally, I think if there is a head injury on the field and it's witnessed by a coach, I think they have to be seen to provide some sort of documentation that yes or no they can play or not, or there's a concussion or not. But symptoms following a head injury that might indicate concussion are headache, regular daily headache, fatigue, disorientation, sometimes dizziness, sleeping more, nausea. Those are sometimes the more mild ones that you might be able to pick up on if they're trying to hide it.
Talk about nutrition. Oftentimes for some students, the best meal of their day happens to be in school because the families are constantly different schedules. Some of the children are given, you're responsible for fixing your own breakfast, and maybe they come home and they order something fast food like. Yeah. What are your recommendations for very active families?
I definitely do encourage all my patients to have a breakfast before school. I think it's important. Sometimes it's really early in those older kids and they might not want to eat first thing, especially if they're up and rushing to get to class. So I usually suggest that they pack something to bring to maybe eat a little bit later. Some schools do even have breakfast, so it might be something that if it's too crazy in your house in the morning, if the school does offer a breakfast program, you might kind of tune into that and at least have them eating something when they get to school, even if it's not first thing in the morning. School lunches are available. Sometimes they're not as healthy as what you might make yourself, but it might be the easier route. Some older kids don't always like to pack their lunch and bring it either. But if there's things they don't like, sometimes packing the night before, engaging your child in the process of what do you want to eat, what do you want to bring, what would you like for lunch, let's make it together. Even sort of food prepping for the week, you could sometimes put stuff together and bags or Tupperware that you can just get in the morning and throw in the bag and have and be able to take to school. But try and definitely encourage that breakfast meal, because I think that's important to have at the beginning of the school day, because their brains need food to work good just as much as it needs the learning to work good.
Trends. What kind of trends are you seeing among your families that are coming in? The good, the bad, the indifferent trends. Any that you want to share? State of health and wellness of our young people today based on your years in practice?
I mean, I guess one thing that I see that concerns me sometimes is overscheduling, being too busy that, they can't get everything in, and then they sometimes will get anxiety because they're not finishing their homework and they don't have time for school and they don't have enough time to get a good night's sleep even, because sleep is very important. And so I think sometimes there's overscheduling, and sometimes there's overscheduling in the classroom too. Some kids will really take on pretty aggressive course loads, a lot of AP classes where there's a lot of homework, and then if they're high achieving in the first place and play a sport or have a job, there's just not enough time in the day to do it all. And then I tend to see that their sleep will suffer, and then they come in because they don't feel good and they don't understand why, and it's like, okay, well, 5 hours of sleep at night is not enough. So, look at that schedule, make sure there's enough time in the day. You want them to enjoy high school and not be stressed and working so crazy to get everything done that they're not getting a good night's sleep and not feeling physically well at the same time. So that's probably a trend that I see the most, is that sometimes there's too much and you need to back off and take maybe a couple AP classes and then take honors for the rest or something. Pick the ones that are going to be most important to your future careers or goals, and not try and do it all.
Is there anything else you'd like to share with the families in this back to school season?
I think, get your forms into the school, make sure if you do have an athlete that your physical hasn't expired, because sometimes last minute, oh gosh, they need to try out and their physical's been a year and a half ago, because usually the school will only take it if it's within 13 months. Make sure that, if your child has a health problem like asthma, diabetes, that you make sure the school has the medicines and things that they need. Touch base with the school nurse. Make sure any particular orders in regards to their illness are on file at the school. And then have your asthma action plans, get your EpiPens in, make sure they're not expired. That's probably the big ones for school readiness.
Thank you, Dr. Boutwell.
You're welcome.
Much appreciated.
You're very welcome.